Dr. Michael Wasserman is the medical director at the Eisenberg Village Skilled Nursing Facility in Reseda and the president of the California Association of Long-Term Care Medicine. He joins us now live from Los Angeles. Really great to have you with us. With where the current conditions are, you've so much as said, if it were up to you, you would not even put your own mother or grandmother in a nursing home right now. That's a pretty big statement.
Well, look, that was my heartfelt reaction at the time. And the reality is I would be someone, being a geriatrician, who would be capable of bringing my loved one home. So, that said, the challenge is what we do in the nursing homes around the world right now to help protect those who are living there. That's what really matters.
President Trump announced a plan earlier to protect older Americans in care facilities. Some of those measures include raising infectious disease standards and conducting inspections. What are you looking for from the federal government to deal with these outbreaks?
That's a wonderful question. Inspections are not actually going to help right now. In fact, when you're in the middle of a crisis, having inspectors come into a facility are only going to increase the chaos and the challenges that the staff who are working so hard to fight this virus are dealing with. So what we need is support. We need help. And actually, we've developed what we're calling our quadruple aim. Number one is just stellar infection prevention. And the one thing we do need is every nursing home in the United States and honestly in the world should literally deputize a person whose only focus is to make sure that everyone in that building is doing the best infection control, the best hand washing. But then they also need the protective equipment, the masks, because if you're washing your hands but you don't have a mask and you don't have gloves, the infection is going to take over. So those two things are fundamentally important for any nursing home as well as assisted living facility around the entire world. And then the other thing that is critical is you need to know if the infection's in the building. And so we've got to be testing. And everyone's talking about testing everywhere. The number one place we should be testing is testing the staff in all the nursing homes and all the assisted living facilities, because they're the vector. They're the folks that bring the virus into the building. And then the virus grows and multiplies, and the staff get it, and the residents get it, and then both die. And we're not just talking about saving the lives of nursing home residents. I just heard a horrible story from a colleague in another part of the country where, in addition to nearly 20 deaths in their nursing facility, 2 of the staff have passed away. And you can trace it back to the fact that when the virus started, they didn't have the protective equipment, they didn't have the testing, and they only knew the virus was there when people started getting symptomatic. And that's the other really
Well, you
important
bring up a really
thing.
good point, because yes, I think you raise a really important point, which is it's not just staff members that can bring the virus into the facility. They're also taking it home to their families and spreading it outside of those facilities. You have had a case of COVID at one of your facilities that was actually a result of a patient transfer. When you look at how easily it is, even with all the precautions that you could put in place, for just one person that has the virus that can so easily find its way into a facility, how do you fight that?
Well, actually, you do, because one of the things we're thinking is if you allow the viral load, if you allow the amount of virus in an enclosed space to just sort of explode, that's when you end up with Kirkland. That's when you end up with the facilities in Italy and Spain and England everywhere around the world where what you need to do is the moment you know that the virus is in your facility, you literally need to be doing everything right to limit the amount of virus that's spreading. And you know, we actually tested a facility as well as our facility and found out that most of the staff and most of the residents had the virus, but they didn't have symptoms yet. We whether I don't know how we were so fortunate, but we did test. And once we knew that, we immediately went into protecting everyone. Everyone's wearing masks, everyone wearing their protective equipment. That was a month ago. And in that facility, there's only been 4 deaths. And 3 of those residents who died were already nearing the end of life on hospice. So I think the message out of this is we shouldn't be giving up. When it comes to nursing homes and assisted livings, we need to be helping them. We need to be supporting them. And here's a big important thing for the whole world to realize. We're talking about opening up again. If we open up and we haven't protected not only our loved ones, but the staff in retirement communities, assisted living, nursing home communities, we're going to be fanning the embers and restarting the virus because it accelerates in these environments. But we can make a difference if we focus our efforts on testing and protective equipment on these congregate living settings for older adults.
Michael Wasserman, we really appreciate you coming on to give your very important analysis on these outbreaks that we continue to see at these long-term care facilities, not just here in the U.S., but around the world. Thanks for that.